Hi, I am Candelaria, and I am going to raise awareness about HIV and AIDS. Estimated 36.9 million people suffers from HIV, in which 35.1 million are adults aged 15 years and above. 1.8 million are children who are below 15 years old. 9.4 million are unaware that they have living with HIV. In the Philippines, an estimated number of people having HIV is 5.2 million, where 3 out of 4 know their status and 4 out of 5 are undergoing treatment. In 2008, there are 32 Filipinos who are diagnosed daily with HIV and AIDS. Majority of the new infections were teenagers and young adults aged 15 to 24 years old. Out of 8,533 new HIV infections in 2008, 8,066 were males, while 4,067 were females. The rise of the numbers of the people who contacted HIV is very alarming, and we need to stop it. To stop HIV, first, we must understand what is HIV. HIV stands for Human Immunodeficiency Virus. When a person is positive with HIV, you have an infection that attacks the immune system. If not treated, it will cause AIDS or acquired immunodeficiency syndrome. AIDS is the final stage of HIV infection, where the body is too weak to fight ordinary infection. HIV travels through the blood and attacks certain white blood cells that helps your body to fight infections. The virus moves copy of itself and multiplies inside your body. AIDS can cause different illnesses like meningitis and encephalitis that affects the normal function of the brain, pneumonia and tuberculosis that affects the respiratory system, chronic diarrhea that affects the intestines caused by infectious parasites, and cancer such as Kaposi sarcoma. Now, we will tackle how HIV gets transmitted. You can get HIV through 1. Unprotected sex, by transmitting through certain body fluids like semen, vaginal fluids, and blood. 2. Sharing drug injection needles, by sharing contaminated intravenous drug puts you at high risk of HIV and other infectious disease such as hepatitis. 3. During childbirth or breastfeeding, infected mothers can pass the virus on their babies. HIV is hard to detect, but here are some of the symptoms upon acquiring HIV. 1. Fever. 2. Fatigue and headache. 3. Swollen lymph nodes, achy muscles, and joint pain. 4. Skin rash. 5. Nausea, vomiting, and diarrhea. 6. Sore throat and dry cough. 7. Night sweats. These symptoms are very common with every infection and disease you might get. So the best thing to do is to get tested. If you think that there might an instance where you can get HIV, you shouldn't be afraid nor ashamed to get yourself tested. Prevention is better than cure. So, here are some of the ways to prevent contracting HIV infection. Number 1. Practice safe sex. If you are sexually active, make sure to always use condoms. You should also use water-based lubricant to prevent condoms from tearing. Number 2. Use a clean needle. If you use needle to inject drug, Make sure that it is sterile and don't share it. Number 3. If you are pregnant, get medical care. If a mother is HIV positive, she may pass the infection to the baby. But if you receive treatment during pregnancy, you can cut the baby's risk significantly. Number 4. Consider the drug Truvada. The drug Truvada can reduce the risk of sexually transmitted HIV infection in the people that are very high at risk. You need to take it every day, but it doesn't prevent other STIs, so you still need to use condoms and you should practice safe sex.
My advocacy is to end the stigma in HIV and AIDS. In the Philippines, HIV and AIDS is a taboo topic that wasn't openly talked about. Many persons with HIV don't know that they have it because they don't get themselves tested. And when they found out that they have the HIV, they don't even talk about it, even with their own family members. And that is really saddening, as they were afraid and ashamed from the criticism and judgment from other people as well as their own family members. The stigma starts with us by the wrong way of thinking that society engraved into our minds. For the long time, we aimed for equality in gender, race, religion, with our beliefs, and now it's a time for us to establish equality when it comes with healthcare. HIV and AIDS should be treated like any other disease until when it comes to the time that it is normal to talk about it.
To end the stigma on HIV and AIDS, first, we need to educate those people who don't fully understand what is HIV and AIDS. It should be taught inside the school. The children should know what is HIV and AIDS alongside with other healthcare conditions. We should teach them acceptance and respect to one another at early age. Second, the government should take action in order to end the stigma on healthcare like HIV and mental health. The government should allocate proper budget that in the near future would lead to the end of HIV and the stigma. And lastly, to end the stigma, everyone who is watching this, start the change within yourself. And if you know the truth and the right thing to do, try to help those people who don't understand. Let us use our voice and make an impact into our society and to the future of the mankind. Let us stop the hate, let's spread awareness and the stigma.